Hello, my name is Brian Edwards. I'm Dean of the School of Liberal Arts at Tulane University, and welcome today for our special session in Tulane Innovation on COVID-19's impact on K-12 schools, students, and lessons from the fall. We're thrilled to have you here. We're going to have a nice and engaged conversation with three of our faculty experts from across Tulane University and be having plenty of times for you to send in your own questions as we engage on this very complex topic that is obviously on the minds of many people, if not everyone in the United States right now, as we move through one of the most incredible periods in our history, to be sure. Let me first introduce our wonderful and expert panelists, and then we'll get right into our conversation. I am joined today by Doug Harris. Douglas Harris is professor and chair of economics at Tulane in the School of Liberal Arts, and a national expert on education policy and research. He is the founding director of the Education Research Alliance for New Orleans and the national director for the research on educational access and choice, as well as the Schlieder Foundation Chair in public education. And we're really thrilled to have Doug joining us today. I'm also joined by Dr. Lauren Teverbaugh, who is a pediatrician and child and adolescent psychiatrist at Tulane University School of Medicine. She has a wide-ranging background in research and clinical work, which is centered on social and community activism, healthcare disparities among the medically underserved, global health, sickle cell anemia, and trauma-affected youth, as well as public health policy. She provides patient care as well in community healthcare settings and supervision and teaching to medical students, residents, and fellows in school-based clinics. So joining us, thank you, Lauren, for joining us today. And also joined by Nghana Lewis. Dr. Nghana Lewis is an associate professor of English and Africana Studies in Tulane School of Liberal Arts, as well as a faculty affiliate in the School of Law and an adjunct professor in the Department of Psychology. Dr. Lewis has published and lectured widely on her research, which cross-sectionally studies HIV/AIDS, hip-hop culture, and Black women's health. She has been recognized for her professionalism and community involvement, receiving the Roddy Richard Lifetime Achievement Award for her commitment to serving Louisiana youth and the Suzanne and Stephen Weiss Presidential Fellowship for outstanding undergraduate teaching at Tulane. And I am just simply thrilled to have three experts from across the university talking about this topic today. Now I'm going to start with Doug Harris because we have a little bit of news in a sense, or breaking news. This morning, Doug and his group released the results of a new study about how America's schools responded to the COVID crisis. And this is one of the largest and most comprehensive studies to date on what America's schools have done to respond to the pandemic. And for this survey, you looked at 3,500 schools across the country, Doug. Let's start off by telling us a little bit about what you found and what's in this report.
Sure. Well, thanks very much for having me here. So at the beginning of this whole crisis, we started to ask ourselves, what could we do to be most useful in this situation? We had a research center. We had people who really wanted to try to help address the problem, and so we sort of took a blank slate and said, let's put aside what we were doing before, and let's look at what would be most helpful. We reached out to our policy partners and ultimately settled on the idea of looking at school websites as a way of learning what schools are doing. One of the things that's useful about that is if we can figure out what schools did before, it would actually give us some insight into what we could expect to have happen in the fall. And to make this useful, we needed to do it a lot faster than we normally would. It would normally take us a couple of years to do a study like this, and we had to do it in this case 17 weeks from beginning to end. So there are two key findings, I think, that I'll start with. There's a lot in the report. One is that the strongest predictor of how comprehensively schools responded was the education level of parents, whether they had a college degree or not. In retrospect, this wasn't actually all that surprising, because when we look at other past research just under normal operating procedures, parent education is actually the strongest predictor of student outcomes. In this case, even more so, I think, because education had shifted home. So all the things that parents with college degrees would normally do, they were doing a lot more of it. And those parents had white-collar jobs where they could walk down the hall, take breaks from their own meetings, and see how their kids were doing and check in on them and help them along. And get more experience with educational technology, more likely to have high-speed internet, So all those things then affected how the schools responded, because the schools can only get so far out ahead of where the parents are. So that was one key finding, and I think makes us worry about the achievement and opportunity gaps that are likely widening right now. The second finding is actually back to internet use, that the second consistent predictor of how schools responded was actually, again, whether families had access to the internet, to high-speed internet. So that gets us to things that are more immediately solvable, I think, from the standpoint of policy, that this is something we can do. We can provide universal high-speed internet, and we don't have that, but I think it sort of leads us to raise attention to that issue as something that policymakers really need to address.
So, Doug, you mentioned that the backgrounds of parents and how schools then in turn respond. COVID-19 has disproportionately affected Black and Hispanic populations. How have the closures, have they also exposed inequities in schools that may be themselves widening now?
Yeah, absolutely. So the other thing we did in the report was to review survey evidence. So what we're able to look at from the websites is what schools did. But what we're really interested in ultimately is students' experiences. And when we look at the survey evidence, there are also clear gaps by race and by income in student experiences. Having an engaging curriculum, having access to live instruction, video-based instruction, and progress monitoring by the schools, and so on. So absolutely, I think it's safe to say that unfortunately all of the gaps on every dimension you can think of, that those are all widening right now, and it's a real concern. I think especially looking at the COVID, the harm that COVID itself is doing. So you think about the higher rates of infection and death amongst, especially the Black community, that makes this an even greater challenge and unfortunate situation.
Thanks. We're going to come back to that and look at some of the implications as we move to the fall. But I want to turn to Lauren Teverbaugh for a moment. From your perspective and your expertise, what you're seeing, what are some of the main issues that children have struggled with due to the school closures and the lockdowns that we saw in the fall, in the spring? You have to unmute first, yeah.
Great. Yeah, so sure. There are a number of challenges that children had, especially due to the abruptness of the school closure. So for students who have other mental health concerns, particularly anxiety, depression, any issues with trauma, sometimes those children experience an exacerbation of some of those symptoms, right? Anyone who has underlying mental health issues can, in times of stress, experience exacerbations, especially for children who weren't doing so well prior to the pandemic, right? But for some children, we saw that they did better, especially those children who have social anxiety or anxiety, school anxiety based. So the transition to more home learning was a good thing for them, right? Additionally, those kids with neurodevelopmental disabilities like ADHD or autism, those children tend to thrive on consistent routine schedules, and the disruption of schedules that we saw with the transition to moving out of the classroom to homes, especially if there was not support, right? Normally these children get quite a bit of support in the school system, whether that be through their special education programs, their teachers that pay special attention to them and implement certain plans for them, as well as the disparate access to resources, technology resources, right? We saw some children who did not have Wi-Fi access or consistent Wi-Fi access or computers, right? Chromebooks that were utilized, and that made the transition difficult for those as well. So we saw, I've been seeing a wide range of reaction all the way to, for some kids, a positive transition and ease of transition, and all the way to those children who really had a difficult time with their transitions.
Thank you. What are you hearing from parents? And I suppose it's more on your clinical side of it. Have you been hearing more complaints from parents about behavioral issues? And what kinds of advice have you been giving to parents when you hear those kind of comments?
Right. So again, a range in terms of, and often it has to do with family resources. So those families who did not have to try to return to work without particular resources for their children and home care resources, fared worse than those families that did. The parents, I think, for those kids who didn't transition well, had behavioral challenges that were related to the loss of routine. And for those families, I recommend that they set out a routine. And it does not have to be a strict routine, but something that mimics, because kids are very used to their school routine, something that roughly mimics their school routine in terms of waking up at a consistent time, certain allotted times during the day where they're working on schoolwork, having breaks, especially those who have attention issues and difficulties, having scheduled routine breaks that can often serve as a reward for doing homework and those things that aren't so fun when you're at home, right? And also being flexible, right? Being flexible for if you're having a really hard time, if your child's not understanding the material, if they are really having a difficult time with adjusting to what you've put in place at home, allowing flexibility, whether that be shortening the times that you're scheduling those school activities, lengthening the reward time, and really, if possible, communicating with the child's teacher to see and to ask what things worked in the classroom setting, what can I be implementing at home, and if the school is able to be a resource, using the school's special education teacher and social worker as resources in those ways.
You know, I think one of the things that we've all been noticing, struggling with, learning from is the ways in which communication is so dramatically different just 4 months or so after everything shut down. And so just listening to the great advice that you're giving, how almost in a public health sense, how are we getting these kind of messages out there, or what are the struggles? I mean, obviously the disparities that you and Doug were just talking about in terms of access to technology make getting out some of these messages challenging.
Right.
How have we been engaging that, or what are some, obviously this webinar, we would love everybody to hear it and get the advice out, but what's some of the thinking about that right now?
Right. I think that is also what I'm seeing with my parents. It's very difficult because the information is not widely disseminated at this time. It's still being figured out, especially here in Louisiana, in terms of a strategic plan for what's going to happen for our kids, whether it's going to be some hybrid method, if it's going to be a complete return to school, or if it's going to be all online. And I would say that that is one of the most important things, because it's also part of how parents can help their children, is to plan, right? Is to have and talk about a plan in terms of, if this happens, then this. And so that information from the school districts and from a public health perspective is important, because it helps families to start to have a conversation about what school is going to look like in the fall, start to anticipate some of the help and assistance that they'll need. And yes, unfortunately, right now, that information is not as easy to get universally, like across the nation.
Right. All right, we're going to come back. I keep saying we're going to come back to the fall. I'm going to turn to Nghana Lewis for a couple of questions. I'm partially lingering here on understanding what's happened so far, because obviously it gives us a lot of understanding and background for thinking about what comes next, but also because obviously the spring has not only been so historic and dramatic, and we're still trying to understand it through the kinds of clinical work and the research that Dr. Teverbaugh is talking about, and these large surveys that Doug Harris and his team has been in. But I want to turn to Nghana Lewis and ask, I mean, this spring has been dramatic and historic, not only because of the 100-year pandemic that we're in, and the ways in which society has operated in dramatically different ways in terms of shutting down and all of the kinds of disparities that this exacerbates. But for the students of the K-12 and certainly beyond, are living through extraordinary times, not only in terms of public health, but in the protests and the discussions and the very public discussions around racial disparities in communities across the country. Students are bearing witness to and frequently participating in a national movement against and protesting systemic racism. So I'd like to talk a little bit about that and how this kind of layers into the conversation that we're having right now. And first, do you think that the COVID disruptions, the massive disruptions from COVID-19, set the stage for younger people to be more likely to mobilize for change or to have those discussions in a more public fashion?
Well, I think that COVID-19 has created an opportunity for mainstream audiences or audiences that follow mainstream media to see how these various issues and health disparities in other contexts have disproportionately impacted Black people. I do think that it's provided a context for us to see it in the mainstream. But I don't believe that young people are necessarily any more engaged. Those who were engaged in the Black Lives Matter movement, for example, were already engaged. Black Lives Matter has been working to mobilize and has been quite effective at mobilizing and calling attention to the injustices that are at the center of that organization's agenda. Since George Zimmerman was, rendered not guilty for killing Trayvon Martin. That work has been ongoing since that time. But I do think that COVID-19 has created, there's more visibility. The revolution is now being televised, whereas before, it just wasn't on the mainstream, the attention or the radar of mainstream media in the way that it is now.
Yeah, and we'll follow up on that. Let me remark, if you have questions, and we're going to start working in some questions from our audience, please enter them in the chat. We'll see them, and then we'll turn to you. I like the reference to Gil Scott-Heron, the revolution will be televised. And of course, and here we are on Zoom essentially and in a webinar, a lot of people have used different technologies than television itself to stay in contact or be in contact. Does that, and again, thinking about what the impact has been, does that different sort of context for communication or for organizing or for getting people out make a difference now? Or is that part of what we're seeing in terms of public attention, or is it just the attention of the media?
I think absolutely the technology, as we've seen changes in technology over the decades. I mean, if we think comparatively, the moment that we're experiencing right now, in terms of how social media has impacted capacity building at a much greater rate. We saw a similar dynamic on display during the civil rights movement of the 1950s, 1960s, when television was used or able to be used to mobilize, to organize, to heighten awareness. Emmett Till's mother was intentional, right, about wanting her son's casket to be open so that it could be seen. So I think, yes, absolutely, advancements in technology, the work of social media is doing exactly what it's intended to do, or what, not necessarily what it's intended to do, but what it has the capacity to do around building energy and continuing to expand capacity to do the work that these organizations are doing. But again, I want to continue to sound the point that these organizations have been doing this work with or without the attention of mainstream media, with or without capacity expanded through social media, because there's been a kind of groundwork that's always been operating and that's been swelling amongst those people who have been committed to these issues for some time.
Right, so we think then that, and I'll turn back to Dr. Teverbaugh to ask this question too, but do you think, Nghana, that the kind of the very public and the more expanded, let's say, discussion around anti-racism and around Black Lives Matter that has kind of taken much attention during the second half of the spring is expanding that conversation to students and children. And we're really talking about K-12 here, in a broader context than it had been before. And if so, and again, I'm going to try to make it a complex kind of two-part question, two different people on the panel, but is that having an impact on students themselves, and high school students and younger themselves, in terms of how they think about the present as we move into the present and the past, in a sense, as we move into the future? I'll start with Nghana for that big, complicated question. I love multi-part questions.
Yeah, it is big and complicated. And Brian, let me say this. I have been, I've said this in a couple of other contexts, and I'll say it again. Over the past several semesters that I have been teaching at Tulane, and one of my areas is Black Studies. So I have the opportunity to teach around the work that I research on. And in doing so, I have been amazed and nicely surprised by the thinking, the depth of the thinking, and the innovative ways of thinking that our students are bringing to the classroom around these issues. So I'm incredibly surprised and always amazed by the language and the capacity that my 15-year-old daughter has. And so I'm hesitant to say that the young people who are out there doing the work and engaged, that this moment that we're in with COVID-19, and even with the heightened visibility of the Black Lives Matter movement in mainstream media, that it's somehow expanding their awareness or their consciousness, because it seems to me that I'm being newly educated on the incredible capacity that young people have. Now, they may not be as sophisticated in terms of knowing how to transfer or translate their understanding, their knowledge, their inquisitiveness into policy, change it at the level of policy. But they certainly have the curiosity, and they're certainly much more adept in their thinking than I know I've experienced in the number of years that I've been teaching, which is 15. That's been within the past, I'd say, 3 to 4 consecutive semesters. I'm pleasantly surprised. I would love to hear what the other panelists have to say about this, because I'm hesitant to say that this moment is doing work that hasn't already been done in some way, shape, or form, either at the high school level, or quite frankly, it could be that, you know, I haven't done enough patting of my own back and the backs of my colleagues in terms of the work that we've done in the classroom that has had an impact. But that's where I am. I'm not quite committed to saying one way or the other whether this moment is affecting the change.
It's a great point, and I'll turn to Dr. Teverbaugh. It's one of the things that I've been really that kind of corresponds with this moment is the arrival, let's say, and again, 3 years ago, let's say, of what we call a new generation, Generation Z, coming into college. Now, as a cultural historian, one is always a little bit hesitant to overemphasize what different ideas and attitudes in generations, and Doug has thousands of surveys to help us back this up, let's say, but there is something particular about the experience of the students who started arriving at the college level in the last 2-3 years, and it's something, I think we put a link to it, a piece that I had published in The Hill a few weeks ago that got circulated quite broadly, what I was trying to call the fractured generation, and noticing that the students, people who were born around 1997, 98, '99, which are now those who are just finishing college or juniors and seniors in college, were really the first generation not to remember a world before 9/11. We're also a generation and kind of grew up in really a state of war, essentially, or occupation in the Middle East. That may be relevant, and if they had family members who served in the military, or just the ways in which cultural television shows and cultural attitudes kind of represent this period of real violence in the world. But also a generation that grew up very deeply digitally connected, as we know. And we look at, I mean, these are kids, depending on how old they are, who grew up with just generations of smartphones, various social media, from Instagram to Snapchat, obviously, to the TikTok as a new one, and what that meant for organization. So this is also a generation that grew up with very visible discussion, not only of the very racialized killings that you're referencing, Nghana, but also school shootings, which may overlap with those, that many of these students really grew up doing duck and cover like activities or lockdowns in their schools that arguably had a big impact on them, and somehow have used, especially in the March for Our Lives movement, for example, that came out of South Florida and Parkland school shootings, technology somehow as if to do things a bit differently. So it's striking to me and to all of us as we look at this generation that now the first wave of so-called Generation Z, who grew up with all of these experiences, now has their college years disrupted so profoundly, and it's sort of like the bookends to a very unusual generation. It may form them. Anyway, let me see what you think from your perspective, Lauren, on this. I mean, are you seeing the kinds of impacts more broadly that might be generation defining, let's say?
Yes, absolutely. I think what's really interesting and is that kids these days, more so than ever, like they are so adept at technology, right? They are so adept at social media, using it to explain, to talk about themselves, right? And also to see and observe the experiences of others. And I think as part of this particular time, that is what has been empowering for children and adolescents and young adults of color, is that they can use their voice, right? And their advocacy can be very, very, very easily done on social media using tools that they're very adept at, right? And so it's empowering for a lot of children, right? Also, because everything is so on social media, we're also, these are times we feel it, right? Our children feel it. They know exactly what's going on. They may not know all of their feelings about it, right? But they do know that they're angry, that they're sad, that they're frustrated, that they, that also it's nice to hear their voices on social media and platforms, right? And so it's a wide variety of responses that kids are having, but we do know that they can have these discussions, and they can have them with depth and thought, right? And that it can start when they're very young, and it should start when they're very young, so that they are able to learn and conceptualize all of these different things that are happening with the help of their adults, right? Especially for our younger children. But the sooner that children start having these conversations, the more comfortable that they are, right? And it's about explaining very big concepts in very simple terms, because like I said, children notice it, right? They know exactly that something important is happening around them, right?
I've muted myself. It's so interesting because as a parent, and a lot of parents have learned to tell the kids, shut off the phones, too much phone, leave it out in the and we've had different moments in the last few years when YouTube stalkers or videos that kind of pirates kind of come in. And at this other hand, you're telling us, and it makes a lot of sense to me, that that social media is a way for younger generation to kind of process? Is that, I don't want to put words into your mouth, but to understand or discuss what these momentous events that are happening nationwide and worldwide may be. So how do we manage that kind of paradox in a way?
Right. And so it's like everything else, love balance, right? So balance is important. To understand what a strength social media can be in terms of allowing young children and young adults to express themselves, to find out information, right? And that it's a tool that they are very comfortable with using. So restricting that, especially when someone is finding that comforting and as well as a way of expressing themselves, can be detrimental. On the other hand, we know that exposure to too much social media, too much news, too much of the catastrophic thinking and media that sometimes can be portrayed in terms of this all or none, this panic type environment, that can be anxiety producing and cause mood issues as well. And so it's finding a balance between allowing that as a platform, allowing some time for that, especially the social connectedness that's important during these times of social distancing and physical distancing. So finding a balance between that and then also restricting some of those things that can be more anxiety producing. So we do know that there's one should not be on social media or watching the news 24/7 all day long, right? That having a couple of hours, 1 to 2 at max, is usually advisable.
It's good advice. I find, I'm going to turn to our question. We're getting great questions on the chat. And let me encourage those who are listening, attendees. We have many hundred right now. I had the number a moment ago. Please put your questions in on the chat and we'll call you up. I'm going to turn to Jim Ezel, who has a question for us that'll bring us to talking about the fall. Okay.
Hi, sorry. I just was watching NBC this morning, and LA Unified announced that they will not be having in-person classes for the fall. Since they're the nation's second largest district, do you think that will cause the dominoes to start to fall?
Great, thank you. Thank you for asking the question. This is what I also like. Let me just say, I'll turn to Doug to answer this. That we're in a very high-tech Zoom webinar format, and it does have a bit of a nostalgia for the radio call-in show too. So I really like that. I appreciate that. Doug, you heard the question. LA Unified made an announcement this morning. What are your thoughts on that?
Well, just to clarify the announcement, I think what they're really saying is that they're not going to open in person. So I think one general theme of what's going to happen next is it's not going to be all one thing for the whole school year. I think most school years will start one way, and by October, November, they'll be doing something else. In January, they'll be doing still something different that, in response to changes in the public health situation, in response to their own experiences in the school, in response to local conditions, including outbreaks and flare-ups and the virus, that it's going to be a changing environment. I think this is true of the colleges as well as the schools, that this next year is going to be a rough year. It's going to be an uncertain year. And I think what schools are doing is coming up with contingency plans. So if we're in phase 1, here's what we're going to do. If we're in phase 2, here's what we're going to do. And that's just going to be different in different places because of different conditions on the ground. But I don't think it's going to be for that reason, I don't think the dominoes are going to fall based on LA, because LA Unified is a very different kind of district. It's one of the largest, if not the largest, in the country, and it's in a city where community spread is likely to be higher.
So it's interesting, and when you were reflecting on the college side for this, Doug, I mean, as different schools, as different universities, as different school system look and watch what each other is doing, there's also certain specifics that could be geographical or in terms of scale that will lead to different sorts of decisions. So despite the idea of a kind of a domino effect, you see a very big, Cal State system had made an announcement on the university level some time ago, but you didn't have the same kind of effect in different settings as well.
Yeah, no, I think that's right. I think a lot of individual decision making going on.
it's interesting how it goes back to what Lauren was saying earlier. When we're watching news, and all of us are, even those, you know, having long days studying this or making decisions or working on fall planning, you know, we're all consumers of news, especially using our phones and using links from all sorts of social media. And there's a certain kind of effect, it seems to me, you know, where one announcement kind of resonates through the country and kind of leads to, oh my God, things are changing here at the same time as it's a bit, as things do become kind of localized too. I've got, I'm looking at my notes for a question that we've got through the registration. I would love the panelists, someone has asked us in the registering to cover the social or emotional aspects of remote learning, let's say for those schools that do that. And then Lauren, a question for you. What kind of uncertainty, you know, as we talk about like the LA decision that will get news attention, even if it's translated in certain kinds of ways that may only get half the story, what kind of uncertainty will the effect of that uncertainty be on parents and kids in their ability to adjust? You know, you're planning for one thing here in New Orleans. The New Orleans Orleans Parish public school system has made some very comprehensive plans, and they're very laid out, and people have been reading them, and they have K-5 children in schools 5 days a week. But then at the same time, it's all contingent on staying in a certain phase. And so you have both a real sense of rigorous planning that's reassuring for many people, and at the same time, the idea, as Doug had just mentioned, things could change quickly. But what's the, you know, I have two different kind of questions out there. I'll start with you, Lauren, on that. What's the ways in which people respond emotionally or psychologically to that kind of uncertainty? And then we'll talk a little bit more about preparing for the fall in that of the other panelists. Lauren. Yeah.
Right. So living in uncertainty and not having a plan is very disconcerting, right? And so for our parents, it's anxiety producing. For our kids, it's anxiety producing. You want to, there's a certain routine that once you're after K1, you know, kindergarten, you know what going to back to school looks like, right? You know what the school supplies routine is, you know what new clothes look like, you know what it means to get up, to catch the bus, all of those things. And so it's disconcerting when those things aren't in place and you don't know. However, I do commend the school systems for all the work that they're doing to try to plan as much as we can, right? And for our families that are at home, as they're looking and reviewing some of these plans, they can start to think about what it looks like now, right? And also what it looks like when things might change. And those plans are somewhat written in a lot of our school systems plans, right? That we have alternate ways of thinking about how our children are going to be educated. The best thing for parents is to understand that it's okay. It does not need to be perfect. Your plan does not need to be perfect. Nobody's plan is perfect. It will change. And as you can have some acceptance of that, it makes it easier to communicate that with your children, that things change. We are going to be as flexible as we can. This is what we think is going to happen. These are alternates that we think are going to happen, but these might change at any time. And as a family, we can get through it. We're going to talk about it, and we will get through it. And we will pivot. We will adjust based on what works best for our families, that it's individualized. That part is important because every child is different. Every family is different. And we have to normalize that uncertainty in these times is normal, and it's okay. It doesn't mean that we're doing anything wrong, right? And I think that for our different families, those contingencies plans are going to look differently. And as our schools are starting to think through what it means to be equitable in our delivery of services to children, that part will be important to communicate as well. What does it mean to have, to not be able to get the Chromebook that is recommended? How will that affect my child's education, right? To anticipate that there are going to be kids who have special needs, who are going to have social and emotional needs that need to be accounted for in the plan, spoken with, from teachers getting appropriate education on how to deal with those situations, especially if they're remote learning that's happening, all the way to the students, and helping them to understand that they may have reactions to changes such as anxiety, changes in mood, changes in behavior that should be anticipated, planned for, and then have some resources for them so that in the event that there's professional help that's needed, that is available. Okay.
Doug, in your survey that just came out this morning, are you seeing some of the reflections on those kind of disparate experiences across schools that Lauren is talking about there, or how does I know a survey measures things a bit differently, of course, than a psychiatrist, but how are you which is the benefit for our multidisciplinary panel, of course, but how are you seeing that kind of in the survey results, that wide range of experience?
Well, certainly schools responded in very different ways to the crisis, and it goes back to the different circumstances and so on. I think Lauren makes a great point about trying to at least have different, what I would think of, I'm paraphrasing, different scenarios. Okay, we have a few different scenarios that are going to be present at different times, the phase 1, phase 2, phase 3, and so you can at least create some certainty around there being a limited number of things that are going to happen. And some things are pretty definite. There's going to be a teacher, and there are going to be classmates, and you're going to see them somehow. We just don't know how you're going to see them. And as she said, having on a more, I mean, I took Lauren's point to be more about one-on-one relationships, about, between the parents and children, and between teachers and children, and so on, about having plans for when things get difficult. And things are going to get difficult. It's not going to be an easy year.
Doug, and I'm going to, Nghana, go ahead. Yes, please.
Yeah, so we're having a conversation that is kind of making me a little uncomfortable, because it's so neat and nice, and our school systems are messed up. And particularly on a local level, our school systems are messed up and have been. And the disparities that we're seeing in terms of how people are affected by COVID-19, those are the same kinds of disparities. Doug, you spoke to this earlier, but I think that there has to be some honesty around how much worse the situation is and will continue to be if we don't have plans in place that not only address the learning challenges that our students are confronting now, students with special needs, students who don't have special needs, but also disparities that have created gross barriers to learning in our schools well before COVID-19. We're not being honest in our discourse about that. And that's part of the problem, right? We haven't really had, and it's not disconnected from larger conversations that we are invited to have now about the various ways in which the Black Lives Matter movement is encouraging dialogue, or has pushed dialogue and discourse around reform in the institutions, the police institutions throughout our country. Our education system has been messed up. And so we have to be honest about that, and not disconnect conversations about how we address distance learning, or whatever the learning mode is going to be moving forward. And that's all I have to say about that. I'm just kind of frustrated, because this is not nice and neat. We've experienced problems for decades now with our school systems and disparities, and that have disproportionately impacted Black children and poor Black children. And it's not any different. We can't disassociate that conversation from the conversation that we're having now about how to move forward.
Yeah, and this goes back to our earlier dialogue in this webinar about the ways in which the public discussion and the discussion of anti-racism and disparities throughout the system is related to the COVID-19 pandemic. There was a certain public discourse in which it was like, oh, well, first there was this, we had this big thing, and then we had this big thing, as if it was a sequence of unrelated crises. But in fact, I mean, as you're suggesting, these are deeply related crises, and the public discussion around Black Lives Matter that comes out in the middle, essentially, or 2 months into, or the much more visible discussion is not a separate one in that sense, right? So again, then how can we, and you know, how do you feel about this, Nghana? I mean, one of the discussion before about generation forming and the optimism you had about what students showing up in college today are able to teach us and how they're able to use their voices. It was notable too. Is this crisis then, the COVID-19 is framing our discussion today, but is this crisis a moment for bringing to the fore a much more public, a much more widespread acceptance of the deep disparities that are structured through the system? Do you see evidence of that in public discussion?
I see evidence of it certainly in terms of conversations that we're having about policing, and the various ways in which we might systematically begin promoting policy changes that can improve relationships between the police and communities of color, especially Black communities. I'm waiting for the deeper conversation in the context of education. I mean, we're talking around it, but the synergy is not as strong as it could be. I mean, even with respect to New Orleans public schools, there's a difference in how the fall might look like or will look like for Benjamin Franklin, where my daughter attends school, in comparison to other schools that are not as resourced, that don't have parents who have as much capacity, whose jobs have more stability and maybe flexibility. We need to have a deeper conversation and I think more difficult conversations that we're not quite yet having.
We've got now a lot of great questions coming through on the chat, and I'm going to turn to one of the questions. I'm going to turn to Lisa Rice to ask a question to the panel. Hi, Lisa.
Hey, hi, everybody. How are you doing? Can you hear me?
Yes, we can hear you. Great.
Oh, okay, great. Thanks. So I'm just wondering what kind of trends you're seeing for those students who were seniors in high school and had that year interrupted, and many of them going on to college, and what are you seeing and hearing about the decisions being made by their parents and I would assume jointly with them about going to school, you know, going to campus, going someplace new in this environment? What's up?
It's a big week for that. A big week for that nationwide, as a lot of
Yeah.
schools announced their plans recently and have given students a short amount of time to respond. Does anybody on the panel want to take on the question?
I could just say in my limited experience, because I do work more with younger kids and high school kids, but those that were seniors that were going off, right? Some of their changes, they've had to have some changes to their plan. Not only is there anxiety about what it looks like to go off into a new environment, where it's still unclear what they're walking into. A lot of school systems still have not, or university systems still have not have a concrete laid out plan as to what they're walking into. There's anxiety about contracting the virus. There's anxiety about, in addition to all of the new things that normally come with going off to college. There are some students who can't go off to college, right? Finances have changed such that it no longer makes financial sense to send their child off to college. And so now we're looking at them going to a college that's more local, or going to one of the community colleges, or deferring, right? Decision to work instead of going off to college this year, or just to wait and see, right? So there's a lot of uncertainty. And so those are some of the main changes that I've seen related to COVID. And then also, again, how COVID is affecting families disparately and disproportionately depending on what their race and class and other statuses are.
Yeah, we're definitely seeing nationwide some students making choices to stay a little bit closer to home. And as you say, Lauren, the massive economic changes when you're at historic unemployment, and a lot of people, especially, especially middle-class families who are carefully saving, lost savings for that has made quite a difference. Okay, I have another call-in question from, let's take us in another direction. Great question, Margaret Wong. Am I calling on Margaret, or am I going to read her question? Margaret, there you are. I see you popped up there. Go ahead, welcome. As the host of this call-in radio show, all in our home studios as we are. Okay. Oh, Margaret, I'm asked to tell you to unmute on your side, and then we'll hear you better. There you go. Hi.
Hi, thank you for the this panelists. Really enjoyed all the actually all the Tulane Unplugged series. Can one of you or all of you address the teachers and the teaching professional and physical and psychological pressure on them? Because you've been talking about the children, the kids, but how about you all, your teaching professionals? Thank you.
Thank you so much. It's obviously a crucial question. As a panel of teachers ourselves, we certainly care very much about the teacher side of the equation, and we have been focusing on the students and the parents. I'm looking at your faces to see who wants to jump in here. Anybody want to have something on the teachers?
I mean, I'll chime in. There hasn't, just anecdotally, I can speak to having knowledge of grave concerns that many of the teachers have about returning, being compelled to return to classrooms because of their own physical health challenges, in addition to the fact that many of our teachers are parents, right? They're parents who are in the position of not only having the stressors associated with their job and what they're expected to deliver, oftentimes in compromised situations, but also with respect to having to now be home engaged in educating their own children if it's distance learning. And so it's additional stressors that are placed on teachers who already have so much, stress associated with the job. So yeah, again, in terms of deepening the conversation and recognizing the complexities of all of these issues, we can't lose sight of their voice, which is often not given enough weight and consideration.
Well, and it's obviously, it's a great question. And as you point out, Nghana, the complexity becomes more complex when you realize that teachers are parents and parents are teachers in different school systems, and going to drop off children at some of the schools that our children go to, and seeing each other and recognizing that those teachers are also parents. The centrality of the public school system throughout the nation, throughout the economy, becomes really key as people are paying a lot of attention to. Doug, does that show up in thinking about the fall right now as you look back on the spring, as people engage that with your survey data?
Well, I think the data we looked at, not the data we collected, but looking at other surveys, I think teachers are very worried about, not on an emotional level and a stress level, but also trying to think about how they're going to still change yet again how they're teaching and under this flexible kind of model where they're going to have to be ready for everything, while also being at work they're going to have to be ready for everything, at home they're going to have to be ready for everything, and it's really hard to have that much uncertainty on so many different levels when all those things kind of need to fit together for the teachers when it comes down to actually working with students.
Yeah, one of the what's clear, and we say it, and parents say it frequently about K-12 teachers and how central they are to their children's life. Everyone will know that, but also how has become so evident how central they are or we are, but teachers on the K-12 to the entire United States economy and its present and future, right? One of the images that we all have in our short history so far and what seems like a very long time is people in different cities around the world standing out on their balconies, banging pots for frontline workers, healthcare workers, who are obviously heroes in all of this, but teachers now also, especially as we're looking in just a few weeks to the start of school, have taken on a whole different role. Lauren, can you say anything? Actually, I have time for one. I'm told that we're wrapping up, so I have time for one more question. Okay, yes. So let me, yes, and it's a great kind of opening, closing question to Doug, and then we'll circle back around. How does the reopening of schools, this is the economics question, fit in with the reopening of the economy as a whole? Has been sent on for me to ask to you.
Yeah, clearly, parents, a lot of parents are working parents, and if they're also having to be teachers at the same time at home, then it's going to be much harder for them to get back to work. I think there's also a larger psychological element of this, which is, I think we're not going to feel like we're getting back to normal until the schools are open and students are going to school in person again. So I think that also will have an effect. I mean, the last point, which is somewhat different to the question, is that I think it's going to be a very slow recovery. So that could have impacts on school funding. It looks like this year we might be okay school funding wise. I think the federal government, Congress will pass something that will make this year manageable. But this is likely to be a long-term recession that's going to have funding impacts in the long term. And so even if we're schools open, there's this larger challenge to how well we do it with the resources we have.
And Lauren, so I can ask you one last question. Again, we talked earlier about uncertainty and what the burdens, the psychological burdens of that are on children and their parents. What about this idea that of the temporality or the longevity of this crisis? Not one of the things that's been striking throughout is we don't quite know how long to prepare ourselves for. And I often use long distance running metaphors. It's one thing it's better to know how to pace yourself if you know how long the race is. How is that kind of play into the emotional responses, not knowing how long this will last?
Right, and I love the running analogy. I'm a runner myself. So it is about pacing yourself, and even in the uncertainty of not knowing the time frame, sometimes it's best to say this is just a new mindset, right? This is a new way of thinking, right? With that, I don't know the end. I know it will eventually come, because that's hope, that's optimism. It will eventually come to a time where we are closer to normal, because I think normal is going to look different in the future. We will never go back to the way things were, and in some ways that's really good, right? But what is it? Let's start to shift and change the mindset to we're going to get back to a formal normal, and then also that take it each chunk at a time, right? A step at a time, whether that be a week, whether that be a month, whether that be 6 months, and keep it at that, right? Break it up into chunks so that it seems and feels manageable, right?
But Nghana, to give you a last word, what's the not normal, when we say, like, when Lauren says, we may not get back to normal, that would be a good thing. That seems to also kind of coalesce with some of the comments that we've been making today.
Yeah, absolutely. If this moment tells us nothing else, it lets us know that there is great capacity for change, right? And great opportunities right now that we can, with honesty, with candor, and with persistence, we can affect change that is sustainable and that is good in multiple areas. As it relates to our public health, as it relates to our policing, as it relates to education, if we have those conversations. We have to have those difficult, tough conversations and acknowledge the many levels on which all of these dynamics are interconnected. And yeah, I mean, I agree with Lauren. Change in this regard is actually, or should be, welcomed.
Well, you set it up very, very well. To have difficult conversations, to have conversations that go in so many directions is obviously one of the benefits of this format, and the benefits of being in a great university like Tulane, where folks who are coming from so many different areas and studying problems that matter to the world, that matter to us personally, that matter to the nation, are discussed and debated. I can't thank the three of you enough for taking the time out of your schedules to join us for this conversation. I thank the hundreds of of attendees who've been sending in questions. I'm sorry for those that we didn't get to, but they've been informing our conversation. We really appreciate you listening in. We thank you all, and thanks, of course, to the wonderful team who put this together on the Tulane side. It's a wonderful series. We're pleased to be a part of it. Thank you again, and take care for all parents, students, teachers, and those who care about them who've been listening as we move to a fall that will be challenging, that will have lots of bumps and some big bumps and little bumps along the way. It won't be a quick recovery, but to take the optimism that came out from the last several comments, and hoping that we will take advantage of this rupture, this very difficult rupture in which, of course, many people and friends and family have been lost, to affect some positive change for a greater future is certainly a hope that can keep us motivated as we move through the fall. So thank you all for joining us, and have a good afternoon.